Very happy New Year to everyone. I am Dr. Wongchuk Doma. I'm a consultant at Venu Eye Institute. Today, I would like to discuss a few points relating to dry eye. Dry eyes are something which is very common nowadays, and the cause of the dryness is either because the volume of tears which is being produced is inadequate, or the function of tears is inadequate. That is, they are not able to do what they are programmed to do. That's they're not able to wet our eyes efficiently. So one of the main contributing factors to dry eyes is increasing age, and dry eyes is also very common in post-menopausal women. It is also associated with a lot of autoimmune disorders like rheumatoid arthritis, SLE, and thyroid disorders. Contact lens users are particularly at risk to dry eyes. And nowadays, with a lot of use of computers and smartphones, these two tend to increase dry eyes, especially when we're using them over a long period of time. And the normal room conditions, the indoor environment that you're working in, if the indoor environment is very dry, then that too leads to dry eyes, especially nowadays in winters in Delhi, where we use a lot of heaters and blowers in the room. So how do we know that we have dry eyes? So there are a lot of symptoms that dry eye patients have. These are, of course, dryness in the eyes. Then there may be something known as paradoxical watering, where the dryness itself leads to watering from the eyes. The eyes may turn red. There may be blurring of vision. There may be some kind of a sensation as if you have some foreign body in the eye, or there may be grittiness in the eyes. There are a lot of medical and surgical interventions that we can do for dryness, but I would like to touch upon a few lifestyle modifications that we can do for dryness. So one of the main things is to avoid smoke, avoid pollutants in the air, and especially with Lodi coming up this weekend, avoid smoking too. Smoking too increases the risk of dryness. Then when we are using any video display terminal unit for a long time, it is better to increase the frequency of blinking. So after every 15-20 minutes of use, please automatically blink your eyes, or we can follow the 20-20-20 rule for computer users. That is 20 minutes of use on the computer, and move your eyes to a distant object. Focus on a distant object, preferably out of the window if possible, and then for about 20 seconds. So 20 minutes of working on the computer, look at a 20-foot distance object for about 20 seconds. And increase the frequency of blinking whenever you're working on the computer or any VDT. Then the third thing that you can do actually for increasing dryness, decreasing the dryness, is increase the humidification in the room. So for this, we can use room humidifiers if possible. And also try to stay away from heaters and blowers. Don't use them too much because that increases the dryness in the rooms. Smoking, as I've already told you, and contact lens users try and avoid the prolonged use of contact lenses for too much. Thank you.